Hi, Dr. Roseann here, and today we're going to talk about social skill deficits in kids, and I'm going to share with you a wonderful teletherapy activity to do with kids who are struggling with social skills. I am an integrative and pediatric mental health expert who is on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on your notifications so you get my videos every week. Let's dive in. Difficulties with social skills is one of the biggest problems I've seen increasing in children in the last 30 years. And why is that? Kids today don't have an awful lot of free time to play, and they're not having unstructured play. And when we have unstructured play, kids learn how to work things out, they learn how to problem solve, and they learn how to manage their own frustrations and stress. We have stressed out kids with a lack of problem solving skills playing together. Without an adult moderating those play activities, it's kind of a disaster. And those of you who have a kid who might be more impulsive or is missing some of the rules of play and social engagement with other people, you know exactly what I'm talking about. You often have to pop in as a parent, or if you're a teacher or anybody working with these kind of kids, they just need things to be a lot more explicit, clearer, and broken down for them, and they need to be supported. I often teach my parents to become parent whisperers during play dates, to be there close, to give cues on how to get through it, right? Not to punish kids, not to pull kids out, but to work through and learn those skills. The CDC rates for autism is 1 in 57 children. So children with autism always struggle with social skills. Even when we know our kids are interested in socializing with other kids, it may mean they're not so great at it. And we need to really be helpful. In my book, The Teletherapy Toolkit, we have an amazing activity that is about how to dissect a social situation. It's a technique called social autopsy, and we have a very visual way to do it. But let's talk about what a social autopsy is, because it's not a dissection of the human body. It's a dissection of what went wrong in a social interaction. When somebody is struggling with understanding the rules of social interaction, whether it's because they're being impulsive or, again, because they just don't see the other person's perspective, we need to teach our kids how to look at the situation and then think of different ways to problem solve. If we just say to kids, well, you shouldn't have done that, they're not going to know what to do. So a social autopsy takes a situation and helps the child to see it from both vantage points, not just their own. When we have a child who is struggling in this situation, they don't see the gray and they don't know how to put themselves in another person's shoes. Our job as parents and professionals is to teach them how to see the other side. And when we teach them to see the other side and give a lot of repetition and a lot of reinforcement, they will get it eventually. With a social autopsy, you want to start with, let's talk about that situation at the playground. So Jimmy was over here with the ball playing with his friends, and you didn't like that he didn't want to play Star Wars. So you came up to him and you threw sand at him because he didn't want to play Star Wars, which he normally does every day. Children are going to instantaneously feel blamed and sad about it. But what you want to do is, okay, let's dissect. Let's break it down and figure out exactly what happened. And you can even, for kids on the spectrum or children that are really defensive, you can even make this as a third party. You could say, oh, I was at the playground yesterday and I saw that Jenny wanted to play with Carla. They were going to do this game and that game and do the same thing, but use different names. It takes the personalization piece out and they won't be so defensive and they're better hear you. Concentrate on feeling words. Really important. How do you think Jenny felt in that situation? How do you think Carla felt in that situation? And you want to start breaking down and getting them to connect to feelings, because the feeling they may be feeling is anger. They may be feeling frustration, irritation, and they're not able to see what's happening to the other person. Key component in good social skills is empathy, right? Just like we talked about, seeing the other side and having another perspective and seeing that gray. Many children with social skills difficulties are black and white thinkers, and it's that gray that makes them so uncomfortable. These kids can be great at regurgitating and repeating information, but when they actually have to take action, that's when the breakdown happens. And these social autopsies and understanding what went down, what was the breakdown, and what you can do differently is so valuable. Then what we want to do in the social autopsy is we want to talk about expected behaviors. Often these children are missing those nuances, and that includes expected behaviors. Because when something is expected, it means that there's an implicit understanding that's part of the rules. Kids with social skills difficulties don't get implicit. That falls into the gray. I hope you're having an aha moment if you're a parent or a school professional, because this is why we need to be incredibly explicit and have things meet that black and white need so they can get into the gray. In my social autopsies, we write it out. I love to do social stories with pictures. I'm a terrible artist, but man, I can make a mean stick figure. And you want to just get out a stick figure, and you can even put little words to say out of their mouth, and you want to replay it. And especially for little kids, you can make a little picture story on your own, keep repeating it, having conversations. There's a wonderful app called Pictello, and you can make it really fancy if you want with pictures of your kids. Again, some of these kids are really defensive, and putting a picture of them may be offensive to them at that subconscious level. So you want to always meet a child where they're at. We always want to use these strategies, but we want to take a common sense approach and make sure that we're putting information that's digestible, broken down, making the implicit explicit. And that's what a social autopsy does. It's a wonderful tool. What's my Dr. Rowe know? Thinking that just because your kid wants to socialize or maybe is polite, that they actually have good social skills. What I hear is parents and professionals coming to me saying, Joey is very interested in interacting with the other kids. He tries, he starts conversations, but he can't really connect with the other kids. Because he's trying and he's polite, people misunderstand what his skills are. Really, what are good social skills? Good social skills involve that back and forth reciprocal communication, right? So it's not just coming in and saying, did you see that episode of X? And then getting stuck on it. It's then saying, how was your weekend? I know you went to your grandma's house. How was that? Oh my gosh, that's so cool. She got a new cat? That's fantastic. And really listening and waiting for back and forth. A lot of times kids with social skills issues, they have a very limited repertoire of things they can talk about, and they don't really inquire what the other person is interested in or what they're experiencing. And after a while, regardless of what your age is, if you're 5 or 20 or 15, the other person is going to feel that you're not interested, and they're going to not want to have conversations with you, and it becomes a lonely experience. So what's my Dr. Rowe go? Social skills can be taught. We often think that children will absorb social skills by being around other kids with good social skills. While that may be true for many kids, for those kids with social skills deficits, they need that explicit instruction. We have to take everything that's expected, everything that's implicit, all of that gray, and we've got to get it in a very digestible, easy to understand way for these kids, and it's got to be reinforced. And they need a ton of practice. They need practice in unstructured play settings with a lot of cueing, and they need practice in structured play settings. What's my other Dr. Rowe go? Give these kids the time and nurturing to develop these skills. They are not going to develop overnight. Learning social skills for kids can be incredibly hard because there's so much that's implicit, from body language to little sayings to play rules that are implicit. These are things that kids are just absorbing. Some kids can't just absorb them, just like I couldn't absorb algebra. And I needed help with that. Don't even say algebra. But social skills need that same kind of TLC. If you're working with a child who's on the spectrum or has ADHD or high levels of anxiety, these are some of the most common barriers to social skills, right? Please know that when we give them lots of explicit instruction and care, and ideally working with a mental health professional who can coach a parent through these and help a child learn these skills. These are some of the best clinical outcomes that I've ever seen, is when somebody really makes an investment of time in working with somebody that can be very explicit in instruction. So remember, if you or a child you care about is struggling, it's gonna be okay. I am here to help show you how to help children and teens feel calm and alert and good about themselves. I want to hear how you are helping kids with social skills issues. So drop a comment below. Catch you on the next episode. And remember to subscribe to the Dr. Roseann channel, where we talk about natural and effective ways to reverse and reduce children's mental health issues.